Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
Learning and implementing new procedures into your dental practice in an effort to help more of your patients is a subject that is near and dear to many dentists' hearts. And from a business perspective, purely business perspective, adding new services to your office, increasing what you're capable of delivering, can be extremely beneficial. Now, with all of that said, and having worked with a lot of dentists over the last, I don't want to say how long, few decades here, there's definitely a right and a wrong way, from what we've seen at least, to integrate new procedures into your practice. So how can you make sure that doing this turns out to be a big win for everybody concerned? Well, that's what I want to talk about in this week's episode. My name is Jeff Blumberg, and I'm your host. And I think the best place to start, before I even get into the do's and don'ts list, we have like three that we've observed over the years, is let's start with a basic concept here. And it has to do with what you as the doctor owner want to do, along with what is best for your patients. And what do I mean by that? So let's say you got a successful practice and you just don't like doing molar endo. It's just not your thing. You're good at it. You're clinically competent at it. You just hate doing it. Well, maybe you have to do it for a bit until you can get somebody else to do it. But then it's not a situation I would perpetuate. You have to stay happy. This is your office. This is your career. So if you're in that situation and you find that you're running into, several molar endo cases a week, maybe you do them until you get somebody else who can, or you refer them out. And you might go, well, I'm throwing revenue away. I shouldn't be doing that. But, if you really hate doing it so much, obviously you have to do what's best for your patients. So it has to be done. Okay. But you have to take a look at what the impact on you is if you're just completely miserable doing what you're doing. You see, same thing with implants. Let's say you enjoy restoring them, but you really just don't want to learn to place them. It's just not your thing, And again, you have to look at what's best for your patients. You're the clinician. I am not. And it's up to you to ensure that they are taken care of, whether it's you taking care of them or ensuring that you get them into the hands of somebody that can or will, whether that's an associate doctor in your practice or someone outside the practice that you're referring to, a specialist or whatnot. My previous dentist, who just retired last year, had a similar viewpoint. She'd been practicing for almost 35 years. And she was good at everything that she did. She'd done work on me over the years. I've been seeing her for 25 years. And, certain things she just didn't want to do. She didn't want to do molar endo. She loved doing cosmetics. So she used to refer a lot of her stuff out, and she had a successful practice. Then she eventually brought associates in as the place got busier and busier, but she always stayed true to herself, and she actually stayed happy and continued to enjoy dentistry. Now, on the flip side of this, well, maybe you want to be able to do everything. You want to be able to do implants, full arch cases, FMR cases, complex restorative cases, handle sleep apnea, ortho, etc. Well, that's great. Then learn to do these things. You see, I guess the point is you have to be happy and stay true to yourself in your career. Now, if this is you want to add a bunch of, higher end procedures to your practice, there are three things that we recommend that you keep in mind, strictly from a business perspective, because again, I'm not interjecting myself between you and your patients. You have to decide what's best for your patients. But from a business perspective, I'm going to give you three basic ideas here that we go over with our clients when this is something that they're looking at. First one is, don't add new procedures to your practice to solve a production or an income problem. So let's say you have a regular old general dental office. Maybe you're not placing implants. You're not doing very complex restorative cases. You're restoring implants. But you've got a general dental, basic general dental office, GP office. And you look at it and you're not profitable. Things are not going well. So you think, well, gosh, I've referred a few implant cases out. If I learned to place implants, all of a sudden I would be profitable. So your motivation for learning, of course you probably want to help your patients. That isn't the issue, but the motivation for learning is to make your office profitable. That is the wrong way of looking at this, because the truth is you should already be profitable doing whatever your average run-of-the-mill GP does. You should already be viable. You should already be profitable. So before I would go jumping off to learn new procedures in an effort to become more profitable, again, unless it's something that I feel clinically I need to know or do just like any equipment or supplies that you might want to use. You have to do what's best for your patients. But if the motivation is purely, I need to make more money, I'm not making enough, so I have to go learn to do X procedure, I would probably take a little bit of a look inwards before I went and did this. If I'm not making enough money doing basic procedures, basic, I don't mean that from an insurance perspective, like basic and major, but I'm doing my normal stuff and I'm not making enough money, I'm going to look internally to find out why before I go trying to do other things to solve that problem. Now, what are a few of the reasons why you might not be making enough money? You might be charging too little. You may not have raised your fees over the last few years. I just got off the phone with a client this morning, and their fees were close to a little bit more than 10% lower than they should be for their area, and they had just raised them by 10%. It's hard to keep track of where fees are at. And, this may be a bit of a controversial statement, but I'll just throw it out there. We've all observed inflation over the last 4 years. If you're a higher earner, if you're earning a couple 100,000, 300 or whatever thousand per year, because you're not running it so close to the nub, so to speak, financially, it takes more time for you to notice inflation. It doesn't mean that it's not eating away at what your standard of living. It is. It's just a lot easier for someone who's making $16 or $18 an hour to notice that food has gone up by 40% than somebody who's making $300,000 or $400,000 a year. They'll notice that their grocery bill's a little higher, but they won't see the severity of it because they're not so close to, bare survival. So, yes, inflation's been eating away at what you've been doing. You may not have been able to keep up with that from a fees perspective. And I would tell you to examine this because chances are your fees are way too low. I've recommended this on the podcast numerous times. Again, I will say I have zero relationship with these folks other than as a consumer buying their products. There's something called the Wasserman Guide. I'll put a link to it on the episode webpage where you can check the CDT codes versus what you should be charging in your zip code. It breaks it down by percentiles. I would make sure that my fees, depending on the type of practice you're running, if you're running sort of like a family practice, you probably want to live in the 50th or 60th percentile range. I'll leave that up to you for you to decide what your fees should be. And again, those percentiles, if I'm in the 50th percentile with my fee for my zip code for a certain CDT code like 2740, what that means is that 50% of the people in town charge more than me and 50% charge the same or less. If I'm in the 60th percentile, 40% charge them more than me. The remaining 60% charge the same or less than I charge. Okay. But I would make sure your fees are in the proper range because if your fees aren't high enough, then you're not going to be making enough money on what you're already doing. Which brings us to the next point, especially for U.S. dentists. If you're in a bunch of PPOs or managed care plans, you're already taking a huge haircut on your fees. That, again, if you're doing regular general dentistry, is going to make it so that you can't, it's just not going to work because, again, all of your costs are going up. So you need to get out of plans. But that's a whole other conversation. I've done several episodes on it. The last thing is if I'm in a situation and I do just basic general dentistry and I have the ability to be fairly productive, but I can't place implants. I can't do full arch cases. I don't really do any ortho, maybe do a few clear aligners here or there. If I'm in a situation where I'm not making enough money and I'm having trouble getting patients to accept full treatment plans, regardless of the alleged reason, how is learning how to do something that's even more expensive for my patients going to help? If I can't close them on a 6 crown case, how am I going to close somebody on an all on 4 or 6 or all on X case? Do you see? Or a huge restorative case where I'm restoring the whole upper arch. I can't close a $6,000 or $7,000 case with consistency. The patient's just doing the 2 crowns that insurance will cover this year. Sure, I'm going to spend $25,000, $30,000 to get the clinical skills to be able to do these advanced cases, but I already can't really sell the basic cases with consistency. So then it becomes a bit of a no-win situation. So I would look at, again, if I'm in a situation where my practice is not viable, meaning it's not profitable at an adequate level, I would make sure that I knew how to sell, meaning I knew how to get patients to want the treatment that they need and pay for it. To that end, I always do a couple shameless plugs during the episode. Here at MGE, we have the MGE Communication and Sales Seminars. This is where we've taught thousands of doctors how to increase their case acceptance. The average increase in the first year is close to $300,000. I put a link to it on the episode webpage. We also have sales training on our online platform, DDS Success. Put a link to that as well. So yeah, that's usually the first thing I would attack if a person isn't making enough income is, let's get you able to actually close cases. The last thing that might be throwing off your income or your viability, your profitability may be staff related. And again, I could talk about this for hours and hours, but you may have a non-productive or a problem employee that's causing, trouble in the practice. You're going to want to address that because again, that's not going to necessarily be resolved by me learning how to do, sleep apnea cases because I have this problem employee. So now I'm making more money and I'm having more problems. So if I'm not making money doing what I already do, I'm going to solve that and not try to use adding a new procedure as a solution to my financial woes. Doesn't mean I'm not going to learn to do the new procedure because the course might be months from now. There might be a bit of a learning curve. I may not be completely confident before I get going. So I'm going to still do that, but I'm not going to use it as the solution. So that's the first point. Second point has to do a little bit with what I was just talking about. Once you learn a new procedure, make sure you're confident in the clinical aspects of it before you start selling it. Because I've seen this is something I see less frequently. But you'll see somebody take a course, some type of CE course, and they're now able, they've learned the skills and tools they feel that they need to know in order to deliver a certain procedure, but they're not completely confident in their ability to do it. So then that shines through when they're presenting that to a patient and they don't close those cases because they themselves don't feel really comfortable doing the procedure. And this is something we looked at because there's a ton of courses out there on, how to do implants or how to do FMR or this or that or the other. And we have several clients, actually we have more than several, quite a few clients who are, uber productive. And a lot of where they gained their skill was from numerous different courses. In other words, they didn't just go to one implant course, they went to 6 and they learned different aspects of it. And this is one of the things we just started doing. We never really jumped into the clinical training realm. It was just never our thing. But we did see that there was a bit of a deficiency in the sense that you have people going to an implant course and they learn how to place an implant, but they don't really know a lot about soft or hard tissue management afterwards. Do you see something like this? So they end up with high implant failure rates or something like this. So what we did, oh God, this is my second shameless plug. I apologize. We actually started a separate organization we called DDS Clinical, which is a clinical training organization where we've curated the really excellent instructors. That was very 80s to say that, really excellent. Some excellent instructors that sort of give you the full picture of what it is that you need to learn in order to properly execute a procedure, whether it's full mouth rehab or implants. And to that end, I'll put the link to DDS Clinical on the episode webpage. We're in the middle of an FMR course now. We have a basic implant course starting out later this year, and then we're doing an advanced one next year. But to give you an idea, just because what I didn't like seeing was someone would go to an implant course and they'd be 65% of the way there. So then they spent the money on the course and they're not really selling implants because they're not comfortable placing them. You see? So if you can get somebody where they're comfortable and they feel like, yeah, I can do this, and there's support after the class in case you have questions about cases and things like this, you're going to be more likely to bring that into your practice. So you could even take somebody who's good at selling, but if they're not confident, they won't. So that's point number 2. Point number 3, last point, shorter episode, is once you learn that new procedure, let's say you're good at it and you can sell it, don't go off doing only that and ignoring what got you there. So I've seen this where someone, really gets into clear aligners or a certain type of ortho or implants, and that's all they want to do now. They forget everything that got them there, the basic restorative work and the management they put into their practice and making sure they had a strong hygiene department and they were doing everything that they normally did. That got them to a point where they thought, I'm doing pretty well. I could add something to my practice. Instead, now that's just their only focus. I'm placing implants now. That's just what I'm all about. And if I need a filling, I'm going to wait 6 months for the doctor to do a filling. We definitely recommend against that. The way you want to look at this is if you add a new procedure, imagine I have my practice and it's running a certain way with the procedures that I can do now and I'm doing, $150,000 a month. So now I'm going to add a new procedure to the practice. I'm going to start placing implants. Let's say I'm referring out, 20 implants a month or something along these lines. So I could add another $50,000 a month to the practice, right? Maybe I was restoring them before, but now I want to place them. I could add another 50. So the way I would look at it is that base practice without any implant traffic should still be doing the 150. I would leave that intact and I would want the implants to add on top of that. And when I say intact, I don't just mean from your clinical time and schedule. I also mean your marketing as well and the way that you structure your practice. I've seen people get into implants or more, complex full arch cases, and then the marketing that was building their practice over the years, maybe they were just advertising to come in for a discounted cleaning or exam or something along these lines, or exam and x-rays or something. They stopped that marketing altogether, and it's all about implant marketing now. It's, I'm doing an implant funnel and I'm doing this and I'm doing that. And they drop all of their other marketing that actually gave them a successful, basic, viable practice. Not what you want to do. This should be added on top. So if we look at how that might roll out, let's say I've got my $150,000 a month practice as a GP. I learned to start placing implants. Well, any marketing I'm going to do has to be done on top of the marketing I'm already doing. Then as I start to get busier doing implants, I have to stay on top of my schedule intelligently. Meaning, let's say I find now, because I've become so busy placing implants, that some of the other work that I was getting done rather quickly is now being pushed weeks or months in advance. Well, I need to confront that. That's a scheduling issue, an assistant issue. Maybe I don't have enough assistants, or I may need an associate doctor to come in and start picking up some of that work. I don't want to slow the flow of the base practice that I'm building this additional line on top of, if that makes any sense, from a marketing as well as from a delivery perspective. It's supposed to be an add, not a replace. We had one client who did not learn to place implants, but realized they were missing out on a lot of implant business. So what did they do? They went, this is a bad example. Well, actually, it's a good example, but what you shouldn't do. So they weren't placing implants, they were restoring. So they thought, okay, you know what, I'm going to bring in an associate who can place implants. So they're paying this associate 40%. But now they start to redirect a lot of their marketing funds towards implant marketing because, it's impactful. It's a high ticket item when you do an implant case. But then when they looked at their net profit after doing that, even though their overall gross went up exponentially, they were actually less profitable than when they weren't placing implants at all, between the associate pay and the additional marketing. And they had actually dropped a lot of the base marketing that they were doing. And that the owner doctor's production had actually gone down. Do you see? I've seen something similar happen with clear aligners where, again, I've been a clear aligner case. So I'm a fan of clear aligners. I'm not a fan, but you have to realize when you're doing clear aligners, they come with a really high ticket lab fee. Sometimes we don't think about that. I think the other day I heard that Invisalign cases are up to, again, they can be cheaper if you're doing more, like $2,000 a case. Well, if you're charging $5,000 for an Invisalign case and you're paying $2,000 for your fee, your lab fee, that's 40%. If it's $1,800, that's 36%. But the problem is, if I do an Invisalign case for $5,000 or you do 4 crowns for $5,000, well, your lab fee on the 4 crowns is going to be what? $400 to $600. The lab fee on the Invisalign case is going to be $1,800 to $2,000. But on the day sheet, it looks exactly the same. You receive the same amount of money as income in your bank account, $5,000, and on the day sheet, it shows $5,000 in production. You're not seeing that at the back end, you're going to be losing a lot more of that money. So again, clear aligners are great and they should be in your practice, but I've seen it where people just go, I love doing clear aligners. That's all I want to do. And that's what they spend all their money on advertising for. And they're not accounting for the fact that the cost of doing clear aligners, the cost of goods, so to speak, with clear aligners is far higher. So then they find out that they're less profitable. So again, if you're keeping that base practice flowing and doing what it was doing before and continuing to expand while I throw clear aligners on top of that, that works. Because the clear aligner cases in and of themselves are fine and they are profitable. But if I'm displacing restorative work or even fillings, which have zero lab fee, or endo, again, zero lab fee, other than the resultant crown later, it's going to start to skew the costs in my business and I'm going to be less profitable. So the way we would sort of look at this from our perspective here at MGE is if we're adding something new, like we've done this, we've added new services, we call that a pilot. Like a pilot TV show. It's something we're trying out. Before we go hog wild with it, I want to see how is this going to impact the organization. And we do this with pretty much everything. Like, for example, our online platform, DDS Success, we're about to switch platforms to this really kind of neat advanced platform. Well, I'm not going to roll out the switch to everybody, without doing a whole customer's user experience survey and piloting it for a while with 10 offices for 30 days. We're doing something before we roll this thing out, because if I roll it out en masse and we haven't picked up all the bugs or seen what the impact is, that could be disastrous. Right now, it's a working platform. Why would I want to just, shift without testing it out and making sure that it's working? It's the same viewpoint. It's a pilot. If we add a new service here at MGE, we don't make MGE all about that new service. It's an add to what we're already doing, with the idea that we're not going to have a dip in the services that we're already doing or delivering. So those are the basic things. It's a bit of a shorter episode this week. But if you keep this basic concept in mind, if you're adding new things to your practice, you keep your base practice intact, and that everything you add should be literally an add. It should come on top of. So if you're producing 150, you add new services, and those new services are 75 a month, you should now be doing 225. They should add to what you're already doing. Don't stop what you're already doing that's already been successful and has gotten to where you or help you get to where you are. And that goes not just from a clinical perspective, it also goes from a marketing perspective. Don't drop the marketing that got you up to 150 to go jumping off into this new thing. Anyway, that's all I have for this week. I wanted to throw that out there because I've had this question asked of me several times, so I figured I would answer it. It's really not that difficult to think with. I do hope that what I went over helps. I put those links that I mentioned in the episode on the episode webpage, the link to the MGE Communication Sales Seminars, to DDS Success, and to DDS Clinical, this clinical training company that our clients use, that we've been really happy with. Again, folks, that's all I have for you this week. If you have any questions about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. Have a great week, and we will see you at the next episode.